News took everyone by surprise. Chris, I'm going to start with you. Can you shed a little light on this positive test, the substances, and what they could have done for Ryan Garcia?
Yeah, I mean, even before I get into the substances, I mean, there's a lot more details that need to come out. You need to figure out, this is going to take weeks and months to really come to fruition for us to understand what's really going on here. In terms of how much of the substances were found in the system matters in terms of thinking of whether this was something that was done intentionally or if it was a tainted supplement of some sort, an accidental ingestion. That being said, a fighter is responsible for everything that goes into their body. Objectively, he did fail the test. Objectively, these drugs did show up in his system, so it has to be dealt with. But in terms of how it's dealt with and the repercussions of it, it really matters in terms of whether it was intentional or accidental. Now, talking about the drugs in general, ostarine is something called a SARM, which is a selective androgen receptor modulator. And if you think about the name about that, selective androgen. So it attacks specific, or targets rather, specific androgen receptors, tendons and bones, which is great for an athlete, right? It's going to make your bones harder. It's going to make your tendon strength stronger, and it's going to make your muscles a little stronger, better endurance. But on top of that, it's anti-catabolic, meaning if you're in a caloric deficit, you're trying to lose weight, you often will lose muscle tissue as well. So when a fighter's coming down weight, or any person is losing weight, you're not just losing fat, you're losing muscle as well. An anti-catabolic, like a SARM, ostarine, is going to allow you to maintain that muscle mass while in a caloric deficit. It was originally created for cancer patients who are suffering from wasting syndrome. It helped them maintain lean tissue. Obviously, there's going to be some really good benefits for athletes, and we see this from the weekend warrior to Olympic athletes, where ostarine has shown up as a performance-enhancing drug. Now, the other substance, nandrolone, that's a metabolite or a byproduct of a very powerful anabolic bodybuilding drug known as DECA to most people. And that's a very strange one to find in a fighter specifically, an athlete in general. It's a bulking agent. It's an anabolic, like I said. There's a lot of side effects with it because that's the thing about taking anabolic drugs like that, because it doesn't just target, like I said, the SARMs do. SARMs target select tissues. Anabolics don't. It's basically just a testosterone bomb in your body, and every tissue is affected. That's why you get so much organ problems when you take anabolics like that. You know, hypertrophy of the heart, damage to the liver. You don't see that in SARMs because, like I said, it focuses directly to muscles and tendons and bones, which would aid an athlete. So, yeah, in terms of the drugs involved, yeah, they're pretty serious. And this is a very serious situation, whether it was intentional or accidental.
And, of course, Chris, you're the guy to go to. Paulie, I got to ask you, on the other side of this, when we talk about fallout for this, we've seen suspensions. We have seen a 2-year one for Amir Khan. Ostarine was the reason for his 2-year suspension. That was the end of his career. I don't think he particularly cared. But what kind of fallout do you expect from this? Off the top, we don't know the whole story yet.
First off, the explanation, Chris, the champ. That's why he's the champ, bro. That's why we got you here, champ. I mean,
I feel like we should just salute Chris.
Right there, because the